So my name is Stefania Ilinca. I come from Romania and I'm a Salzburg Global Fellow. Yeah, currently I work for the World Health Organization in the European region as a technical advisor for long-term care services. But my background is in research and most of my work focuses around equity and access to health and long-term care services and the design of health and long-term care services and policies. There are so many challenges and I would hate to have to pick just one, but I'll talk about the one that's extremely relevant in my line of work, and that is related to care and how care is provided, how care is shared, or rather not shared in our societies, and how it impacts every aspect of a caregiver's life, from health to general well-being to economic and social opportunities. And this is extremely relevant for gender equity because the vast majority of caregivers are women. Our estimates are vague, they're based on fairly poor data, but we estimate that anywhere between 75 and 80% of all caregivers in the world are women, be that informal caregivers who mostly do unpaid and under-recognized or completely unrecognized care work, or formal caregivers. And by that I mean both long-term care workers, community health workers, but also healthcare workers more generally in the health system. I think paradoxically the pandemic has helped a little bit in shining a light on the cause of care and caregiving by highlighting really profound and really deep problems. We can do a lot, we're trying to do a lot. The biggest challenge right now is maybe to scale the good ideas and the good practices that we see all over the world. The first thing we need to do is to recognize the value of caregiving. Shift a bit the public discourse from an overemphasis on costs, on sustainability, on bankrupting our societies, to the contributions that care and caring bring to our societies, to their essential role and values in health, in well-being, in solidarity, in community cohesion. The other important thing we need to do is count carers, identify them, and support them. And there are many, many ways we can do that. We can do it by ensuring that care is shared better within families, within communities, between formal and informal support. We can target specific policies to caregivers to make sure they are facilitated to continue giving care without too much of a cost to their own health and well-being. And in this category of policies, I would include anything from improving social protection, improving access to health and prevention, improving opportunities to provide care while remaining engaged both in the labor market and in social activities more generally, through care leaves, for example, through cash benefits, through each and every lever we have at our disposal. I think it's also important to recognize that while a lot of care, maybe the majority of care that is being provided in the world is very much a labor of love, there are aspects of care that are intensive, that are exhausting, that are akin to a chronic stress experience. Carers who are forced into very intensive and very frequent caregiving, we know very well this has negative impacts both on their health, mental and physical. It has impacts on their long-term economic opportunities. They often have to leave the labor market and find it very, very difficult to return. And throughout their life course, this has a very, very important impact on their earnings and on their risk of poverty. So anywhere in this care cycle we can intervene is important and is an added help.